Imagine for a moment you're 82 years old. You have dementia. You're being cared for in a nursing home. This was the case of Kasem. He was taken from a nursing home in the middle of the night to begin a journey that landed him 1,000 miles from home. What can we learn from Kasem's case as we plan our Advance Directive Health Care Proxy documents? Hello and welcome to this video podcast. I'm John Roberts, an estate planning, elder law, and disability law attorney for people in Hampden County, Massachusetts, and Northern Connecticut. A Health Care Proxy document, also known as an Advance Directive, is a basic part of your estate plan. I want you to understand how much power you're giving to your agent when you sign a Massachusetts or Connecticut Health Care Advance Directive document. California court papers filed by Casey's children say that Casey's wife Jean removed Casey from skilled care at Berkeley East Convalescent Home in Santa Monica at 2:30 a.m. on May 7, 2014, against medical advice of Casey's doctors. Mrs. Kasem had specific power to do that under the Health Care Directive Casey signed in 2011, naming her health care agent. Did Casey understand the power to check him out of the hospital against medical advice when he signed the Health Care Directive? The week-long road trip began on May 7th. Mrs. Kasem drove Casey 300 miles to Las Vegas, Nevada, then down to Arizona, and then back to Las Vegas. During the road trip, other people in Casey's family didn't know where he had been taken. From Las Vegas, Jean and Casey flew 900 miles on a private plane that landed them at an airport in Washington State. Mrs. Kasem sought medical treatment for Casey on May 13th. By then, Casey had a pressure sore and a urinary tract infection. Casey's daughter, Carrie, filed a missing persons report with the Santa Monica police on May 14th, and she learned several hours later of Casey's location in the state of Washington. We may not understand the motives for taking a road trip across deserts and mountains in 5 states at a time when the patient needed care for declining physical and mental health. But we can learn how much power we are granting when we sign our own Advance Directive health care planning documents. The intent behind the authority to remove a patient against medical advice might be to protect the patient's freedom and prevent doctor's orders from taking control of where or how a patient is treated. This power allows the healthcare agent to excuse doctors from the responsibility they would normally have if they allow the healthcare agent to refuse treatment for the patient or discharge the patient from a hospital or nursing home. That can sweep professional medical opinion off the table, though, and federal law requires that nursing homes respect a resident's Advance Directive document. The Massachusetts Health Care Proxy law says you can appoint a healthcare agent who will have authority to make any and all healthcare decisions on your behalf, including decisions about life-sustaining treatment. Connecticut law on appointment of a healthcare representative gives you the opportunity to list your healthcare instructions and designate a conservator to manage your affairs if you become incapacitated. The law says you can execute a document that contains directions as to any aspect of your health care, including withholding or withdrawal of life support. When planning a health care advance directive document, who could anticipate an extreme event like a 5-state road trip? But the Kasem case raises our awareness about the power that's held in the hands of a healthcare agent and the potential for problems if there is conflict in the family. Your concerns may be about medical treatment, medications, home care, or nursing home care, and you may even have geographic concerns. Here's one example. Suppose you have chosen an alternate healthcare agent who lives in another part of the state. Look at what happened in Hampden County Probate Court in Springfield. A resident of the memory care unit of an assisted living residence in Hampden County had designated a close relative who lived nearby to serve as health care agent. But the health care agent was also aging and in declining health and became unable to serve. Family members wanted more care and attention provided for the memory loss so that the resident could stay in assisted living right in his hometown. The alternate healthcare agent who took over refused to provide companionship services and supplemental care so the resident could stay in assisted living. Using the Health Care Proxy, the resident was moved 60 miles away to a nursing home, making it impossible for other family members to make regular visits. Could this have been anticipated or prevented? If the Health Care Proxy document limited the healthcare agent's authority for nursing home admission to a long-term care facility within a certain geographic area, such as 30 miles from my hometown, the alternate healthcare agent would have been required to remember what the memory care patient wanted. Casey Kasem's case reminds us of the need to plan advance healthcare directives so that the document we sign will guide our healthcare agent and protect our interests.